CEN Test Prep Exam Review. Question 1. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A. Pinpoint pupils and respiratory depression. Option B. Dry skin and absent bowel sounds. Option C. Hyperflexia, clonus, and agitation. Option D. Bradycardia and hypotension. The correct answer is option C. Hyperflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperflexia, clonus, rigidity. Question 2. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. US citizens only. Option D. Patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 3. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. Damage above the midbrain. Option B. Damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 4. The safe harbor provision for nurses typically refers to Option A. A law that provides legal immunity in all circumstances. Option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 5. The most common cause of acute renal failure in hospitalized patients is Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Acute tubular necrosis, ATN, is the most common cause of intrinsic acute kidney injury, often due to prolonged hypotension or nephrotoxic agents, causing ischemia or direct tubular damage. Question 6. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes echymosis around the umbilicus. This finding is known as Option A. Gray-Turner sign. Option B. Cullen's sign. Option C. Murphy's sign. Option D. Vrofsing sign. The correct answer is option B. Cullen's sign. Cullen's sign, periumbilical echymosis, and Gray-Turner sign, flank echymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 7. A female patient of childbearing age with abdominal pain should always be evaluated for Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 8. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects Option A. Open-angle glaucoma. Option B, acute angle closure glaucoma. Option C, conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 9. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. The presence of glucose in clear nasal drainage after head trauma confirms a CSF leak because CSF contains glucose, while normal nasal secretions do not. This is associated with a dural tear. Question 10. Which finding on end-tidal CO2, ECO2, monitoring indicates successful endotracheal intubation? Option A, ECO2 of 0 mm Hg. Option B, persistent ECO2 waveform with each ventilation. Option C, ECO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ECO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 11. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, miosis. This toxidrome is most likely caused by option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. The classic sludge M, salivation, lacrimation, urination, defecation, GI upset, emesis, miosis, presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. Question 12. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 13. The antidote for benzodiazepine overdose is option F, naloxone. Option B, flumazenil. Option C, denacetylcysteine. Option D, datropin. The correct answer is option B, flumazenil. Flumazenil is a competitive benzodiazepine receptor antagonist. However, its use must be approached with caution, especially with unknown ingestions or chronic users, due to risk of seizures. Question 14. In distributive shock, the primary pathophysiology is option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Distributive shock, septic, anaphylactic, neurogenic, is characterized by profound vasodilation and maldistribution of blood flow, leading to a relative hypovolemia and decreased tissue perfusion despite normal or increased cardiac output. Question 15. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Headache is a common and expected side effect of nitrates due to vasodilation of cerebral arteries. It is not an indication to discontinue therapy. Analgesics can be given while continuing the nitroglycerin. Question 16. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer. Option A, folic acid. Option B, vitamin B12. Option C, thiamine. Option D, magnesium sulfate. The correct answer is option C, thiamine. Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, common in chronic alcoholics. Thiamine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 17. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 18. A patient with a suspected spinal cord injury develops hypertension and bradycardia. The nurse suspects. Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic activity causing vasodilation, hypotension, and bradycardia. Question 19. Testicular torsion is a surgical emergency that requires intervention within. Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4 to 6 hours. Testicular salvage rates are highest when detorsion occurs within 4 to 6 hours of symptom onset. Delay leads to testicular necrosis and loss. Question 20. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus abdominal film, is the initial screening test for free air under the diaphragm, indicating a perforated viscus. Question 21. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 22. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 23. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all for fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 24. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ichthyosis. Option B, rhinorrhea with glucose-negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Classic signs of basilar skull fracture include Battle's sign, post-auricular ichthyosis, raccoon eyes, periorbital ichthyosis, hemotympanum, blood behind the tympanic membrane, and CSF leak, rhinorrhea or otorrhea, which tests positive for glucose. Question 25. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Pulsus paradoxus, an exaggerated decrease in systolic blood pressure, 10 mmHg, during inspiration, is a hallmark finding in cardiac tamponade and is also seen in severe asthma and COPD exacerbations.